empagliflozin and progression of kidney disease in type 2 diabetes. Definition: Type 2 diabetes is a major risk factor for macrovascular and microvascular disease. Kidney disease develops in approximately 35% of patients with type 2 diabetes and is associated with increased mortality. Empagliflozin, a selective sodium-glucose cotransporter 2 inhibitor, reduces hyperglycemia in patients with type 2 diabetes by reducing the renal reabsorption of glucose, thereby increasing urinary glucose excretion.
Chronic kidney disease, CKD, is a progressive condition that leads to end-stage kidney disease and eventually death. While CKD primarily affects kidney function, it also increases a patient's risk of cardiovascular events. In fact, patients with CKD and type 2 diabetes, T2D, are 3 times more likely to die from a cardiovascular event than patients with T2D alone. Approximately 374 million people have type 2 diabetes worldwide. Up to 40% of these patients also have CKD. In patients with CKD and T2D, 3 major categories of pathophysiological drivers promote CKD progression. Hemodynamic factors, like increased blood pressure. Metabolic factors, like elevated blood glucose. Inflammatory and fibrotic factors, like pro-inflammatory and pro-fibrotic proteins. But one of these is unaddressed by the current standard of care: inflammation and fibrosis. In the kidneys, the mineralocorticoid receptor, or MR, is a key trigger of inflammation and fibrosis. Under normal conditions, MR signaling regulates electrolyte and fluid balance within the kidneys. The MR may become pathologically overactivated under certain conditions, like type 2 diabetes. In patients with CKD and T2D, pathological MR activation in the kidneys is believed to be due to increased expression of the MR and its activators, which leads to the production of pro-inflammatory and pro-fibrotic proteins, inducing inflammation and fibrosis within the kidneys. Renal inflammation and fibrosis gradually cause thickening and hardening of the glomeruli and injure the kidney's tubules. Over time, inflammation and fibrosis may lead to a progressive decline in kidney function, increasing the risk of end-stage kidney disease and cardiovascular events like myocardial infarction or stroke. Because all 3 categories of drivers contribute to CKD progression, all 3 should be addressed in order to alter the course of CKD in type 2 diabetes.
Application in medicine. The use of empagliflozin has been associated with a lowering of glycated hemoglobin levels in patients with type 2 diabetes, including those with stage 2 or 3A chronic kidney disease, and with reduction in weight and blood pressure, without increase in heart rate.
Approximately 50% of people with type 2 diabetes have established kidney disease, directly affecting treatment considerations.
Diabetes impacts a number of organs. Kidneys is one of those important targets. Declining kidney function is very common in patients with diabetes. Most physicians don't recognise the challenges of chronic kidney disease until it's too late.
When you have declining kidney function, it's really important to consider the medications that somebody's on. All medications have different excretion routes, and if the kidney function is declining, many medications need their doses gradually reduced or some medications stopping altogether. It's a really challenging time, and again, conversations are key.
Every patient is an individual. and it is therefore really important to discuss and agree with the patient the best course of action to manage their diabetes and declining kidney function.
Pros and cons. Pros. Empagliflozin has been shown to reduce intraglomerular pressure and improve hyperfiltration in patients with type 1 diabetes, and it has been suggested that this effect may translate into improved renal outcomes. Cons. However, concern has been raised that sodium glucose co-transporter 2 inhibitor may be associated with long-term adverse renal effects. Issue applied in Ecuador. It is necessary to announce to health professionals and patients about this new risk and to inform about the necessary measures to prevent their appearance because information has been realized on an increased risk of non-traumatic amputation, especially in the toes, as well as cases of diabetes, ketoacidosis, of unusual presentation, and several cases of acute renal failure, which the use of these antidiabetics. Conclusion: in patients with type 2 diabetes at high cardiovascular risk, empagliflozin was associated with slower progression of kidney disease and lower rates of clinical relevant renal events that was placebo when added to standard care. Thank you.